Welcome back to another episode with Laura Social Corner, where we share inspiring stories in our community. Today is my pleasure to have the Dr. Tiffany Nguyen-Ngo. So, welcome.
Thank you.
You know, she is an incredible woman. They help in our community. She has her own business. She's a mother. She's a leader. So for me, you are really a part of my inspiration.
Oh, thank you. I really appreciate that.
Could you please introduce yourself and tell us about what is your business right now?
Yeah, I am the CEO and co-owner of ARCpoint Labs of Oklahoma City. Our laboratory is a premier facility where we provide autologous serum tiers, same day, DNA paternity testing, fingerprinting, background checks, and any type of lab work that you need. Yeah.
But this is more than the laboratory. This is kind of different than the other ones, huh?
Right. Mm-hmm.
So why, but you're a doctor, why did you decide to do this kind of testing?
So I'm a doctor of healthcare administration. So my skill set is based on strategic leadership and clinical excellence.
Okay.
And so throughout my 20 years being in healthcare, I've always been in research spaces and in spaces where there is a need in terms of vulnerable populations, complex populations, so addiction mostly. And so when I do, for the laboratory, we do drug testing a lot for pre-employment and for employment and for drug court cases.
Wow.
Yeah.
So growing up, you always want to work in the healthcare and leadership?
Yeah.
So how you know that was your passion?
I think when I was younger, I dealt with a lot of healthcare issues myself. And my parents really couldn't afford healthcare. And it always was like the main focus for me is I needed this, I needed that for my healthcare, but we weren't able to have it. So as I got older, my goal was to be able to obtain that for myself, and then realizing that there were so many other people that need it as well. And so I wanted to give that access to people if I could.
Wow.
Yeah.
That's very wonderful because you earned both master's degree and doctor while you were having a business.
Yeah.
And a mom.
Right.
That is very incredible.
Yeah.
How hard that was?
It was hard, but I have a good support system. Like my family and I are very close.
So your family is your mom. What do you mean with your family? Because it's very hard to.
I have an amazing mother-in-law, an amazing husband.
That's amazing.
And my sisters are always there if I need them. And my mom and dad are always there too. So I can
and a lot of friends that love you.
A lot of friends to support me too. So like my friends support me mentally, and my family supports me to feed me and to take care of my kids when I need it. So I think having a good support system helped me out a lot.
It would be maybe in all this journey a moment that you say, how I can do this all the time. You want to quit it?
All the time.
Really?
Yeah, all the time. Since I started. So I started working in healthcare when I was 14.
Really?
My first job was in healthcare, and I just stayed in it. It was just different types of healthcare, but I've just always stayed in it. But
I think it was on you to help people.
Yeah,
right?
That's what the main thing
and then
was.
you always give it back to the community.
Right. Like I always wanted to be an eye doctor, but then I was like, oh my gosh, I'm not going to be able to be an eye doctor. I can't do this because how can I study for it? I don't know, And then I wanted to be a physician and try to do the MCATs, and I was like, man, this is so disappointing. I guess I'll never be anything.
Oh my God, no.
Yeah. But then, but I loved healthcare so much. I love seeing people thrive and being their best selves. And so I wanted to stay in this field because I felt like that's what I could see from people. I can see them improve, and I love seeing that. And so I stayed and I browsed around and did different types of things.
Really?
So I was a ophthalmic technician for a while.
So you tried?
I tried different things.
Wow.
And
That's
then
incredible.
I became a forensic scientist. And then I did clinical research for ophthalmology and oncology. And then, but then each time I'm like, but I want to do more. And I realized really my thing was I don't need to be hands-on. I'd rather be the person to just direct and be the visionary.
You had the vision, yes,
Yeah.
because you had the vision.
Yeah, but there's much cooler people that can apply them. And so me being the visionary person, applying it to people that actually can't do it, it seems like a better option.
Right. Well, but this is a big lesson because it's your dedication. You have to be very dedicated. You experience yourself, and then you choose to be an owner now and CEO of your own lab.
Yeah.
So that's a big responsibility.
Yeah, that's a lot of pressure.
Yes. How long you have the lab now?
It's about 2 years. I've actually consulted for this lab 6 years ago.
Wow.
With the previous owner, and I just came back to it 2 years ago.
ARCpoint.
ARCpoint Labs.
What does that mean, the ARCpoint?
ARCpoint Labs is a franchise, and we've locally owned it in Oklahoma. We're the only ones in Oklahoma that own it.
You always talk about improving accessibility and high quality. That's part that you get involved with this?
Yeah, exactly that. And so in our program at the laboratory is if there's someone that is needing assistance and they clearly need, like say if they need a point of care panel, something that they would be able to get at a doctor's office, but they couldn't afford it, they can come to us and we can make it more affordable for them.
That is what makes your lab different than the others?
Right, yeah. And we also do physicals. We have providers on site. And we also give resources.
So when you say providers on the site, so we can go to the provider and say, I need my iron.
Yeah.
Because right now my iron is very low. So I can go there and the doctor prescribe me and then do the lab right away?
Yeah.
That is what makes it different than the other labs.
Right.
That sounds more like our country. Our country is like that.
It's like whatever you need, you just say it.
Yeah, you say it, the doctor do it, and it's immediately.
Yeah.
Okay, so that's a really good, it's a big difference with the other labs.
Right, yeah.
I never even heard about it.
It's great, and because of my background in nonprofits, we're able to provide resources for patients too at the same time. So aftercare is easier for people as well.
Wow, that's amazing. You know, it's amazing talking to Tiffany because she always have a good story. And when you talk to her, we can talk for hours because she's always have something to say.
Yeah.
What is your next big plan?
Is to expand ARCpoint Labs to a secondary location. We're going to open
with the same service.
Same services.
Wow.
And we're going to open up on the north side on Memorial. It'll be a bigger lab, and we'll also have counseling. So we'll have mental health inside the laboratory as well.
Oh wow.
Yeah.
So that is, and then you work with doctors with that? They refer it to you?
Yeah, so I have psychologists and LADC counselors on site. So they'll have their own offices inside the laboratory.
Wow, that's amazing. And how your husband is he part of this? He help you with the kids and?
He helps me with the kids, and he's a really good accounting person.
Yes, that's wonderful.
So he helps out a lot. Yeah.
So he's accounting, you say?
Yeah, he does accounting for the lab.
Okay, so it's working together.
Yeah.
You work together, but not together all the time. How you keep the relationship? Because they say always.
You know, we're both Capricorns, and so so work is fun for us. You know, and we have even before we partnered up to do a job together, we always had weekly meetings about finance, about our goals, that kind of stuff. Like we have a whole Excel sheet. We sound crazy, but we have a whole Excel sheet going on, and each tab is each year, and we try to meet our goals every single quarter.
That's wonderful because this is how you help your company to keep growing and
right.
And I think it's very important how you can keep separate what is family and what is business.
Yeah, like sometimes whenever we're talking, we're like, okay, we're talking about work and just work only, nothing about family. And then once we're done with that conversation, we'll close our laptops, then we'll talk about family. So we separate it as much as we can.
That's the best. That's the best way to do it. That is what I do with my husband. In the house, we don't talk about business.
Yeah.
That's it. Car wash is closed. No more.
Done. Right.
Done.
Yeah.
If he says something about it, I'm just acting like I don't hear it, or also like most of the time complain about it.
Right.
No.
Just a little bit, but that's okay.
Yeah, it's okay. No more. It's okay. Okay, no more.
Right. Yeah.
It's very important, and it's bring you where you are right now.
Yeah, I believe so. And, you know, we're really good at also, when it comes to our work stuff, we separate our departments. So I'm more of
Okay.
a very
Yeah.
operations and with the people, certifications, all of that. And he's all the numbers. And so anything that has to do with the people or the operations, he can't touch it, you know?
Okay.
And anything with the finances for me is, I just ask him, is that okay? And he goes, yes. And then we're like, okay, we're good then.
I can spend the money.
Yeah.
You mentioned the concept of task switching, fatigue, and burnout.
Yeah, right.
What are you trying to say with that?
So in my years working in healthcare, a lot of healthcare workers, they deal with a lot of fatigue and burnout. And so my studies in my doctorates was to decrease that, ways to decrease it while keeping the passion alive for healthcare providers. Because when a healthcare provider is a nurse, a tech, a doctor, if you're tired, you're not giving the best quality
Can
care.
any person.
Right, yeah. But like, you know, when you start medical school or nursing school, you have the passion to help people, you know? Of course, at the end of the day, we're all trying to make money, but
Right.
you want to help people at the end of the day.
And that's how you
know?
manage.
But as soon as you get tired and stressed out, that kind of goes on the back burner and you start to not care as much anymore. And the quality of care goes down. You know, you're not happy anymore. And so I want to provide an environment where the providers can still have that passion and have autonomy and still feel like they're doing what they're called to do and still have their own personal lives at the same time, you know?
Right.
So my dissertation was on that, and so I implemented that into my work as well.
And it's a good one. Because this is
worked
very
with people,
inspirational.
yeah, because a lot of people that I work with, they've been with me for like 15, 20 years,
Yeah.
you know, and the things that I've applied, it works so far. Or maybe it's just the group that's around me, I don't know. But so
It's a
far,
balance.
it's
It's a
worked.
balance of personal and well-being.
Yeah, it's a balance. It's teaching people and guiding people and myself too to understand that there's work and then there's home life, you know, and then there's also just you only as a person. Like, what do you want to do? And just being able to balance all of that, it just makes it smooth a lot or go a lot better when it comes to patient care.
Because you say something very powerful, that people don't have to fit into one box,
No.
right?
Yeah. Right.
And
Exactly.
that's very you.
Yeah, exactly. Yeah, you don't have to be one thing. You can be multiple things, but most importantly, you just gotta be you too.
Yes, and enjoy what you do, and
Right.
and trying to be happy.
And it can take a while for you to figure it out too. You know, it doesn't have to be as soon as you're 18, you graduate college and you know what you're doing and you feel happy. Sometimes it takes a while, but I really truly believe that you end up where you should be.
Right.
Yeah.
But it's like you try different things,
So many things.
and,
Yeah.
and then you finally find your passion.
Yeah.
And then also find your passion, you also find the way to help others.
Right.
And give it back to the community. That's very remarkable, because not everybody does that.
Maybe.
Yeah, it's a lot of people they don't, and that is where I'm very proud of you,
Thank you.
because you're so young. What you will tell these entrepreneur people that we have a lot they're trying to do, and sometimes cannot achieve what they're trying to do.
Yeah.
What you will tell them?
Just learn how to pivot. It's okay to fail. Your failures are not true mistakes. It's lessons learned, so that way you can improve when you know, for each moment that you have. You can always do better. Mistakes are just momentary. They're temporary. They're not
Lessons.
permanent, you know? They're just lessons. So it's okay. Just keep going. Just don't sit and wallow. Just pivot. Keep on moving.
That's right. Your story is very inspiring for many women.
Thank you.
And I say women because sometimes we focus, oh, I have kids, I cannot do this, or it's just all mental,
Yeah.
right? And organized. And what is the typical day for you in the morning when you wake up? Really, really quick, tell us about your day, your
My
everyday. When the kids are in the school, because it's
Okay.
different when they're in vacation, huh?
That is true. You know, I get phone calls right early in the morning. So, and like me and my friends, we text each other all day, all night too. So
I know that feeling. Yeah, it's wonderful.
so I'm always up at random times. So I'll check my phone calls, check my emails, my voicemails, check my to-do list, because I have like 6 to-do lists just to make sure I remember things. Check on my lab, check on everybody, and then make sure I finish everything on my task list in terms of like certifications. Are they all good? Are my staff good? Are my interns good? Do I have meetings today? Because I'm on a few advisory boards for Oklahoma.
How many boards are you right now?
I'm on 3.
Wow.
YMM, the Asian District Cultural Association in Okatan, which is for substance abuse. But yeah, so just it's meetings all day. Meetings and talking to people all day.
That's wonderful. You've been showing us that the leadership is not only about building success business, but also creating opportunities for others.
Yes.
You've been teaching us all along. I always very admire you for that. Is any message that you want to share with an audience? Where are your labs located?
My lab is located 2126 South Meridian Avenue, Oklahoma City, Oklahoma. And our number is on Google. So if you ever want to contact us to make an appointment, just go on there. And my only message is just keep on going. There's so many amazing things about life that you can achieve and be a part of. So that's it.
That's wonderful. It was very lovely to hear from you and to people from Laura Social Corner that we can do our dreams come true.
Yeah.
That we can do whatever we want with patience and hard working, like you did.
Yeah.
And you're still doing it.
Always.
Right? And you have more plans, and I think your future is brilliant.
Thank you.
So thank you so much for being here today. Tiffany, you really teach us a lot.
Thank you.
Thank you, thank you, thank you. Thank you for watching us, and follow us and keep sharing our shows and support new business, support entrepreneur people, and that's the way we grow all together.
Yeah.
So see you next time. Thank you.